What is nasal potential difference, and how does it diagnose CF? Imagine a tiny electrical test that can reveal how well your body moves charged particles through your nasal passages. That's what nasal potential difference measures. It's a special test that looks at the voltage difference across the lining of your nose, which depends on how ions like sodium and chloride move through the cells there. These ions are essential for keeping mucus thin and your lungs functioning properly. The key player here is the cystic fibrosis transmembrane conductance regulator, or CFTR, which is a protein that acts like a gate for chloride ions. In people with cystic fibrosis, mutations in the CFTR gene cause this gate to malfunction or disappear altogether. This disruption affects how chloride and sodium ions flow, leading to thick mucus buildup and other symptoms. During the test, a healthcare professional places tiny electrodes on your nasal lining and on your skin, usually on your forearm. They then bathe the inside of your nose with different salt solutions to see how your nasal cells respond. First, they might apply a drug called a miloride to block sodium channels, which normally help sodium enter cells. Next, they introduce chloride-free solutions and agents like isoproterenol to stimulate chloride transport through the CFTR channels. In healthy individuals, these solutions cause predictable changes in the electrical potential because the CFTR channels work normally. But in someone with cystic fibrosis, the potential difference is more negative at baseline, and the expected changes after stimulation are much less or absent, indicating defective chloride transport. This test is especially helpful when other diagnostic methods, like sweat chloride tests or genetic testing, don't give clear answers. For example, if a person has symptoms of cystic fibrosis but their sweat chloride levels are borderline or genetic tests don't find to mutations, the nasal potential difference test can provide additional evidence. Usually, two abnormal readings on separate occasions are enough to support a diagnosis of CFTR dysfunction. However, it's important to note that factors like nasal infections, inflammation, nasal polyps, smoking, or previous sinus surgery can influence the results and sometimes cause false negatives or intermediate readings. That's why the test must be performed and interpreted by experienced specialists. In essence, nasal potential difference measures how well the ion channels in your nasal cells are functioning by checking the electrical signals generated during ion movement. It offers a direct look at the activity of CFTR channels, which are central to cystic fibrosis. This makes it a valuable tool for confirming CFTR dysfunction, especially when other tests are inconclusive. Always remember, diagnosis and management should be personalized, and consulting healthcare professionals is essential to interpret these results accurately and plan appropriate care.